Choptank Community Health opened our first health center back in 1980 in Goldsboro, and from that time we have expanded over the years, always looking at how we can improve the health of the residents in our communities. And as we move forward and learned about different ways to provide access to care, including seeing people where they are, school-based health centers really made sense for us as a service line to develop at Choptank Community Health. So go back in the time machine to 1999, 25 years ago, we got a grant from the Public Health Service. It was called Healthy Schools, Healthy Communities, and we started school-based health centers in Caroline County, and certainly did not do it alone. We have fabulous partners with Caroline County Public Schools, Caroline County Health Department, and the University of Maryland School of Nursing. So opened 4 school-based health centers: Federalsburg Elementary, Greensboro Elementary, Colonel Richardson Middle, and Lockerman Middle. And fun fact too, when we started, the School of Nursing has a well-mobile. And to get things moving, and we weren't ready with all of the space, we had the well-mobile that we were using in some of the school-based health centers back in the beginning, which again 25 years ago, which is just so hard to believe and something we're very, very proud of.
I'm Chrissy Bartz. I'm the Director of Community-Based Programs for Choptank Community Health. So I get to oversee all of our school-based health centers. And currently we have 18 physical sites across 5 counties where we provide school health inside of a school building. So like where we are today, Sudlersville Middle, they look like little doctor's offices inside of the schools, and it allows us to have a nurse practitioner or a PA along with other staff, behavioral health, nutrition, and even oral health. We bring our school-based dental teams into our buildings to be able to see students primarily, but also support staff and support families. So we offer all of the services that we offer in our clinics in our school-based health centers. Like Sarah said, we bring care where the kids are, and they spend a large majority of their day in their schools.
Well, certainly when we think about having a great school-based health center program, those partners are key. Working with the school system as a whole, the school superintendent, the health department is critical as well. And also school staff, the principals in the school and the teachers who are in the school, nurses who are making referrals to the program, sharing information about it so people understand the impact that it can make for their children on a day-to-day basis. My kids are getting older now, but they have used school-based health centers over the years, and I can't tell you what a huge convenience and peace of mind it has been to know that there is a qualified, trusted medical provider in the school who can take care of my kids when they're sick. And in terms of convenience, we can do lab testing right on site. There's been times I think my son had strep throat, and could do the test right there. It was positive. We could run through the pharmacy, pick up the medication, take him home, and we're good to go. So those partnerships are so important to letting people know what is available, how it works, and how it can benefit the families that are part of that whole school community.
We do. We work really hard to make sure that we bring the family in anytime they're able to. Students are enrolled, and once they're enrolled, they're always enrolled. But really what that means is that the family's interested in the service. We call every parent, guardian before we see a child in the school-based health center to let them know that they're there, that they're sick, and that our provider is willing to see them. And then we spend a lot of time after the visit making sure that even though the parent may have not been here, they get all the information that they need, just like they were here at the visit, about what we talked about, the treatment that we're going to give, and the things that we may have sent to the pharmacy. Bringing in behavioral health and nutrition, the other services that we're providing now, we've worked to bring families into those visits as part of, not just the kids here at school, and it's convenient to see our providers, but that it really takes the family, it takes the teachers in the building, it takes our staff to make sure that the kids have what they need to be healthy and be able to learn. So we'd like to really make our school-based health center a hub in the school, a place where families and kids feel comfortable coming down for information and education. And like Sarah said, we work really closely with our school nurses to understand family needs and just kind of try to provide whatever it is they need that we can offer them from the school-based health center's perspective. We, within the last 2 school years, we added 4 additional school-based health centers, 3 here in Queen Anne's County, the first school-based health centers in the county, and then also at Rock Hall Elementary School in Kent County, bringing school-based health to Kent and Queen Anne's for the first time.
I started in Caroline County at Ridgely and Denton Elementary, and then I brought this over here. This is my baby. This is where I was born and raised, and my kids go to school in these schools, so I was very excited to. So we have a secretary that sits out here. You know, it's not just visits, it's just like the staff stopping down to just stop in and check in. It's the parents calling with questions. It's the kids that stop down to visit me to tell me about like exciting things that are happening in their day. So it's really just about, you know, the relationships that you're developing with them and you know, along with their sick visits, you know, that's the rewarding part, is having them come back and seeing you when they're well also.
Part of my career I spent in Caroline County, and we were fortunate enough to have every school to be a school-based health center. I mean, that is incredible. Probably, I think, the only one, certainly on the shore, if not maybe even in the state of Maryland. And those opportunities for our students are just paramount. Being in a community where you don't have access to health care, having a school-based health center is everything. It's not only helpful, obviously, for students to keep them healthy and happy and in the school, which is a place where, obviously, if they're there all the time, they can learn more. If they're homesick, they can't. So, but it's also helpful for parents. They don't have to take off work every time that a child needs to be seen. They not only do they do urgent type things where if you have, you know, the flu or something like that, but other things like sports physicals, which are very hard to access here in our community. So being able to do those as well as clinics and vaccinations and things like that is just very, very helpful. I always refer to the shore, especially where we live, as a desert as it relates to healthcare. And so this just completely eliminates that problem because it's right there in the schoolhouse. And not only just in the schoolhouse, but it kind of seeps out into the community. So a lot of our school-based health centers we've designed so that they have access from the outside. So school cannot be in session. You know, it could be evening hours or even a weekend, and we can have our community access that facility. And that's really important. We don't even have a hospital here in Queen Anne's County. Caroline County doesn't have a hospital. And having this type of care and access directly to our students and actually to our staff, I might add, which is just an added benefit for us because it really is, the purpose is to focus on student health and, you know, student well-being and making sure that they're ready to learn. We're accessing dental care for our students. We're accessing vision care. We're accessing mental health for our students, which is huge. And we just keep expanding that. That's been very challenging through COVID, post-COVID, to be able to actually access health care as it relates to students' mental well-being. They've just been everything to us, and we're so excited to have 3 here in Queen Anne's County, but we're even more excited because we have a game plan, a plan of action to continue to add school-based health centers throughout the district. Well, you can tell I'm passionate about it. Like, I believe in it. And when you believe in something, it makes it really easy, you know, and I know it because I've been with it for so long. So
I just want to congratulate all of our school-based health center providers and care teams on our 25-year anniversary. It is an incredible milestone, and when you think about all of the kids, the families that we have impacted over the years, it's huge. So thank you so much to everyone who's been involved from the beginning and in the middle and where we are now. It has been just a wonderful journey.